Hey guys, welcome back to the show today. And thank you so much for joining me on my YouTube channel, The Stretch Mobility Coach. And I am Kim Nartker, and I help people that have knee pain and want to overcome it. I help you overcome it naturally through utilizing the stretch method. Now, I want you to better understand your knee pain. Knee pain typically stems in our traditional systems to a direct path to surgery. And knee pain can actually be really easy to treat if you seek the right care. So when you learn what your knee pain is coming from and you take the right steps, you can actually avoid knee surgeries like total knee replacements altogether. Now, I can't help you avoid if you tore your ACL or your PCL or things like that. However, what we can do is if you've had those surgeries and your knee is still not right, we can tell you what's going on and provide you with treatment alternatives that can help you naturally improve that pain and get you back to performing like you were. So some of the common reasons for knee pain are injury, disuse, and age. And those are the three reasons that I'm going to be talking about today to break this down for you. So knee pain from injury, it typically stems from the fact that you injured your knee at one point and it has fully healed, but you don't have full mobility or full strength in that area. And you're not going to know if you have that mobility. You're going to feel a little weak, but you're just going to know something's wrong with your knee. And when you do certain things, maybe you have tightness or maybe you have pain when performing those. Disuse is just over time, arthritic changes have occurred, and that also happens with age. And those arthritic changes occur because your joints are not moving the way they're supposed to. And the knee is supposed to kind of rotate so that when you put your foot flat to be able to take a step forward with the opposite leg, that knee has a little lockout mechanism that is supposed to occur. And the joints in that knee, when there is an injury, disuse, or even aging things occur, that lockout mechanism doesn't work anymore. And then as that lockout doesn't work, then you can get tightness in the knee when it bends and tightness in the knee when it straightens out. So to be able to get relief from those things, you have to actually get that knee unlocked and moving correctly. And then you have to make sure that you take the pressure off of the knee by looking up at the hip and the ankle. Now, the stretch methodology is a treatment technique that takes a deeper look into knee pain and tightness, and it provides a natural solution that improves where the knee pain is coming from and then builds a program that will help you regain knee mobility, strength, flexibility long term. Now, the knees, if you've got your knee here and your ankle is overpronating or supinating and your hip is tight up here, it tends to put pressure on the medial side of the knee. That's the inside of the knee. And that's where a lot of people will start experiencing knee pain in the beginning. That pressure is kind of added in this form on the inside of the knee, and it just slightly takes the bone and the tissue there and wears it down, and that's what's bone on bone. And then it works down to where it damages the bone to where it actually causes some damage to the nerves and stuff. So typically knee pain occurs on the inside of the knee, and if it's left untreated, it leads directly to a total knee replacement, because as you're wearing this side out and it becomes damaged, and then arthritis grows in there, and that degenerative portion of what's going on causes so much damage. Sometimes that's irreversible, and the only thing you can do is have a knee surgery. But for those of you who want to avoid that at all costs, you can improve that and take the pressure off of the knee so that it can function more normally. Now, the stretch method, which is TSM, looks at why the pressure is placed on the inside of your knee, and it devises a program that is proven to improve mobility restrictions and then restore strength and keep the knee healthy as you age. Now, some lifestyle changes for knee health. I've seen an increase in knee pain in the summer months. some due to wearing flip-flops. And as we age, changes occur in our joints and muscles that cause mobility problems in the hips, the knees, and the ankles. And it can actually feel like it happens overnight, and your body doesn't signal you to tell you, hey, I have a problem here and here. It does that through compensation, because your body wants to be able to do the things that you want it to do, which is walking, standing, turning, bending, lifting, pushing, and pulling. Now, some knee pain is going to stem from an injury or post-surgery. Other knee pain is going to occur from an instability, and you have to find out what the root cause of the problem is so that you can devise the right plan. The knees, for me, are one of the easiest joints to improve, but most treatments provided today in our healthcare system only offer inserts or modifications that don't actually fix the problem in your knee. And when you find that, then you can actually go down a direct path of damage that is irreversible that can lead you to total knee replacement. Now, I want to empower you to be able to educate yourself on really what is going on with your knee. And if you can seek care that can provide you with that education on what is happening to cause your knee pain, along with, what successful treatment looks like, then that'll take you through a successful program and help you to prevent surgery long term. At the stretch method, we consider pain as a warning and that tightness is a signal. And the sooner you seek care, the better the outcome that you can avoid long-term damage. Now, as soon as you experience pain, make sure that you seek care from your doctor. If he or she does not find anything wrong, that is actually a good sign for you to seek guidance from a stretch mobility coach in your area so that you can live life again without limits. Now, make sure some of the things that you can do today, if you don't have knee pain or you're searching this and you're coming across this video and maybe you have some tightness or you're concerned about knee pain because your family has a history of total knee replacement. By the way, that doesn't mean you're going to have a total knee replacement. Here's some of the things that you can do. Make sure you keep your joints in your body moving normally. Seek preventative care providers that specialize in prevention to help you improve strength and mobility and give you a strength and mobility baseline. And be sure to share your experiences and questions and thoughts and comments below on the YouTube videos here. I'm here making these videos in hopes that I can educate you on prevention, which is not really out there in our community right now. And stretch mobility coaches are the main coaches that can help you prevent and keep you away from surgery. So guys, I hope you found this knee pain video helpful. Thank you so much for joining me today. And if you found that this was helpful, then please subscribe to the show and share this information with your friends and family. And if you are experiencing pain in your knee or discomfort, be sure to look below. I'll put a link for you to search for a coach in your area. And if we don't have a coach listed, then reach out to me and let me know so that I can connect you with the new coaches that are signing on and that may not be listed on our website at this time. Thanks so much for joining me. I appreciate it.